realize.
थोड़ा साइड हो जाओ वहाँ पर।
Dr. Natarajan, we are live. You are muted.
Good morning, sir. I mean, good afternoon.
Yeah.
Good evening, sir.
Good evening.
So we are live.
Okay. So, my part.
Okay. Thank you very much, Dr. Natarajan, for organizing this. Is regarding the awareness of digital retinopathy. And as you all know that India, unfortunately, has become the diabetic capital of the world.
I love you.
The number of cases of diabetes are on the rise, mainly because of the occupational changes that have happened, the lack of exercise, and us becoming potato pouches, as one would say. The quality of the food has also to fast food, and there is a lot of carbohydrate, fat, oil, etc. that is there. So the incidence, apart from possibly some genetic factors of diabetes, is definitely tending to increase, and we have people who will be talking about that. It's a known fact that given a long enough association with diabetes, people tend to have adverse effects on the eye of an individual, and that is often neglected, or diabetics even don't know that they can develop sight-threatening complications of diabetic retinopathy. With that in mind, there was a core group that was formed, and we have been, as All India Ophthalmological Society, holding the screening camp for diabetics to check out for diabetic retinopathy. What is very important is that if diabetic retinopathy is detected well in time, one can reduce a large extent the sight-threatening complication that can happen. Even in the most developed countries, it is the diabetic retinopathy is the leading cause of blindness. In India, though it still remains cataract, but the number of patients who are coming up with sight-threatening complications of diabetic retinopathy is increasing. So what is very, very important is that the ophthalmologists need to team up with the primary physician or the endocrinologist or the diabetologist, so that there is a steady awareness of the fact that an eye checkup is mandatory at regular intervals for all those people who are suffering from diabetes. And if they have diabetic retinopathy, then early intervention and more frequent eye required. So keeping we are in this particular webinar wherein we will wish to increase awareness as regards the importance of evaluation in cases of diabetes and those who have diabetic retinopathy. Or the of the core group for diabetic retinopathy screening has done a lot of this entire group, wherein we are in camps the number of these outreaches that are there. And as you all know that there is so much of work that is going on as regards artificial intelligence for diabetic retinopathy, also for digital picturization of the retina with the even with the smartphones, etc. So I think there is going to be more and more emphasis that is going to be laid on early diagnosis of diabetic retinopathy. So with this, we have an expert panel and a lot of social workers and NGOs who are associated with this. And this is a month-long awareness program that is being done. Thank you very much for participating, and AIOS will write so that the site threat complication. That's it. Thank you very much, Dr. And, you can take
All India Ophthalmic Organization.
Thank you, Maipal. Thanks for the opportunity for continuing our crusade against diabetic blindness. Next, I request Dr. Namrata Sharma, our Secretary General, to talk about AOS and diabetic eye care training program.
Thank you, Dr. Natarajan, for first of all conducting this public webinar on a very important subject like diabetic retinopathy. Like Dr. Mahipal sir also said, that India has become the diabetic capital of the world. And this is a good initiative, and hats off to Dr. Natarajan's enthusiasm. He doesn't want to celebrate the World Diabetes Day, but he wants to celebrate it, or he wants to make everybody aware in the form of one whole month where these webinars would be running every day for the public, and there would be speakers who would be answering the questions, who would be physicians as well as who would be ophthalmologists, who would be answering from the diabetic retinopathy point of view, because we do realize that we would have more of general questions and there would be less of diabetic retinopathy questions. So it is also very important to highlight the fact that in the COVID times, because people have not got checked up routinely, so it is important that they get checked up in terms of diabetic retinopathy, because the diabetic retinopathy progression and the macular edema progression would have occurred in the past few months since March, if they have not already visited their physician or ophthalmologist. So this is the first inaugural webinar in our endeavor of the All India Ophthalmological Society. And also Dr. Natarajan is the chairperson or chairman for the diabetic retinopathy task force. So this is the first of the inaugural webinars, and we are thankful to the sponsors for having agreed to this, and the entire task force, diabetic retinopathy task force of the All India Ophthalmological Society, which has been constituted by our president, Dr. Mahipal Sachdev. So I welcome everybody to this public webinar, and we hope to continue like this for the next whole of the month of November. Dr. Natarajan.
Thank you, Namrata. So now Namrata is actually a professor of ophthalmology in All India Institute of Medical Sciences, and Dr. Mahipal Sachdev is the chairman and medical director of the Center for Sight group of hospitals all over India. So I welcome Rotarian President Kishore Rajshirke, who will be conducting the question answers. And I take the opportunity to introduce Dr. Shashank Joshi. He is the #1 endocrinologist in the country and doing a lot for is the Dean of the Indian College of Physicians. Shashank, can I ask you to give your talk first, because first the diabetes comes, then the retinopathy comes.
So thank you, Dr. Natarajan, and thank you, Dr. Mahipal Singh, Dr. Namrata Sharma. It's a pleasure that you have put diabetes on the focus. I also represent International Diabetes Federation as its Southeast Asia chair. And this is the World Diabetes Month. 14th November is the World Diabetes Day. And we all know that diabetes is a huge problem across planet Earth. And every probably 6 or 7 seconds, we lose one diabetic on planet Earth. We know that the burden of diabetes lies in complications. So, it's a lifestyle disease. We are the world #2, not world #1, but we aim to be a diabetes-free or complications-free diabetes in India, because maybe a diabetes-free India is a remote possibility. And if we do appropriate lifestyle changes, we might see that happening. But I think a complication-free India is possible. And eye is the center of the universe. In fact, one of our themes a couple of years back was eye in diabetes. So that's something which we had as a theme. But this year's theme, as in line with the WHO, is the nurse. So the WHO theme on 7th of April was the nurse. And this year also the theme is the nurse. But the whole idea of the nurse is because, the next year's theme is insulin, because we are celebrating centenary of insulin discovery. Diabetes is a very preventable disease, and complications of diabetes are also very preventable. And all you need to do is, identify the high risk population. And Indians as a race are a high risk population, a vulnerable population. We know that Indians probably are genetically disadvantaged because over centuries we have become a little more sedentary. We were agrarian, and we have switched our gears from an agrarian economy, serialized economy, into a sedentary economy. And we have become now the brain power of the world. We are not the physical power of the world, but the brain power of the world. So we have a lot of glucose. Glucose is needed by our brain. And that's what we have done. And therefore, because we have become sedentary from an agrarian lifestyle, and we have a lot of loading of carb fat diet, poor in proteins, and blessed with genetics. We have two major risk factors. One is if somebody has a family history of diabetes, or somebody has an abdominal circumference for male more than 90 centimeters or 80 centimeters for men and women respectively, you are very likely to get diabetes. And therefore, it's important that you screen for diabetes early. And if you screen for diabetes early, and if you diagnose somebody with diabetes, it's mostly controllable by lifestyle or a couple of medications. But it's important that you see your eye doctor and your heart doctor every year, because one is for the macrovascular complications, which is the cardiologist, and equally important is the eye doctor, because eye is the, or the retina is the window for health in general and diabetic health in particular, and which is why we are all here. And I think diabetes prevention is not difficult at all, because all we need to do is some lifestyle modulation, which is just not eat less, walk more. That used to be a theme in IDF maybe 25 years back. But now we say eat less, eat on time, eat the right food, eat slowly, then ensure that you do at least 10,000 steps a day. If you can build some muscle, do that, because then you can eat more. At least sleep for a good 8 hours. That's equally crucial. And smile. And do some digital detox. Dr. Natarajan is leading this whole movement on WhatsApp vision syndrome. But we know that it's important to recognize that. So I think diabetes is a very preventable disease, and diabetic retinopathy is also very preventable. And I think I congratulate the All India Association for Ophthalmology for having such initiatives. And I congratulate the office bearers, Dr. Sharma, Dr. Mahipal, and of course my very close friend, Dr. Natarajan, for starting this initiative. And I think we are all here to committed to make India a diabetes care capital of the world, not the diabetes capital of the world. And in that diabetes care capital of the world, we all are committed for a complications-free India in the diabetic space. So Dr. Natarajan, if there are any questions, I'll be more than happy to answer, but I'll just be here to listen to you, because you are your focus is retina, and retina, as I said, is the mirror to diabetic health.
Thank you, Shashank. And Shashank is, a leading endocrinologist in the Leelavati Hospital. And I think Mr. Rajesh, Kishore, if you have any questions, I'm just uploading my presentation on diabetes as general. You can ask Dr. Shashank.
Dr. Shashank, there are two questions, or one question into the two part. Basically, it said that diabetes is hereditary. So what is the probability that if the parents have the diabetes, the child will get, and what is the probability that you don't have any history in the family and still person can get diabetes?
So Mr. Raj Shirke, three things. One is that if your father, mother both have diabetes, your chance of getting diabetes type 2 is more than 90%. If one of your parents has diabetes, your chance of getting diabetes is 70%. If any of your relatives has diabetes, then your chances of getting diabetes are around 40%. So that's how the whole situation is. So it's a polygenic disease. So there are two types of diabetes. One is, of course, the diabetes, which is type 2 diabetes, which is typically passing through generations. And then we have a very rare entity called monogenic diabetes, where it is autosomal dominant. It is 3 successive generations below 25 years, doesn't need insulin. So the monogenic variants of diabetes are extraordinarily rare. They are seen in India. They are usually seen in people who have consanguineous families. But the garden variety type 2 diabetes, which you and me think of, the yardstick of, it's very, very familial in penetration. So if both parents 90%, one parent 70%, any relative 40%, that's the thing. As far as type 1 diabetes is concerned, it is less genetic. It has some DR2, DR3, DR4. DR3, DR4 is positive HLA, then you are likely to get type 1 diabetes. DR2 is likely to be protective, but that is less likely, except for conjoined twins, where the penetrance is 33%. Most of type 1 diabetes is not as genetic as type 2 diabetes is. I hope that answers your question.
Yeah, right. Yeah, that answers my questions. Yeah, thank you, doctor.
Yes. Okay. Any other question, Kishore? No. Any other question you have?
Yeah, the only one question, one more question that he said, right, at least can be controlled by lifestyle and also medicine. And many Ayurvedic doctor also claim that, by medicine, they will eliminate diabetes totally. So in such cases, what are the chances of reoccurrence?
So type 2 diabetes is a lifelong disease. You can remit it, but the remission is not lifelong. So, but you have to sustain that lifestyle lifelong. So reversal is something which is very doable by diet, exercise alone. So any pati which will do appropriate lifestyle, you can actually reverse it. That is only possible till the beta cells do not fail. Once your beta cells fail, then you are destined to get diabetes rest of your life. So early diabetes, first 10 years, a lot of people can reverse it by different mechanisms. But later on, it is very difficult to reverse that. So in early part, probably any pati you give, you might be successful, but later on, no. Ayurveda has only two challenges. Number one is that if you give some medicines for Ayurveda, then screen them for toxic heavy metals as well as toxic heavy metals as well as steroids. That's all. But I think diabetes is reversible with extraordinary diet, but it has to be sustained, which is it's very difficult to follow at times. So remember that diabetes is something which needs constant follow-up and constant surveillance.
Okay, thank you. Thank you very much.
Yes, sir. Can I see my screen?
Yes, sir. You stop sharing, sir. Just share
Now
again.
yeah, okay. Now see?
Yes, sir. Just put it on presentation mode. We are good to go.
Okay, yes. So thank you. So I'm here. Thank you, Dr. Maipal, Dr. Namrata, and Dr. Shashank. And I think everybody knows that diabetes is I remember meeting one of the endocrinologists. He told me diabetes means die in bits. I don't agree with that. And as Dr. Shashank said, that you can prevent diabetic complication, and that's why in UK they have people with 50 years diabetic and no complication. I think that's what probably we're aiming at. Because once diabetes comes, it is up to the grave. So I think we have to fight with it. And it's like I always tell every patient, it's like an animal. You can tame it. Only one thing I want to convey here is diabetes affects head to foot, right? It affects the small blood vessels of the body, the brain. That's why you get stroke. Heart, you get the heart attack. Eye, you get the diabetic retinopathy. And if control sugar, I think you can live a
So you need to press the.
okay, what happened? To prevent diabetic blindness, and I call it Jod Se Jod Jalao. So diabetes is now considered the epidemic of the 21st century, and diabetic retinopathy is a major cause of blindness in the worldwide middle-aged population, and the fifth cause of blindness globally. And there are about 415 million diabetics in the world, and Southeast Asia about 78 million. And then they have said in IDF 2019, as mentioned now, it is 77 million in India itself. And that's where Dr. Shashank Joshi is part of it. And this shows the projection in 2040, it may go to 642 million with diabetes. So prevalence of diabetic retinopathy among diabetics in India, type 2, this is again they published in the old journal, and that time it was 69.2. Now in that they have mentioned 18 to 23%. And newly diagnosed patient with diabetic retinopathy is about 6.5 to 11.73 patient. And according to the International Diabetic Federation, India has 77 million diabetic. In fact, by 2030, according to the estimate, 8.4% of India's adult population will have diabetes. And that means 1.3 billion, about 8.4%. And by 2045, India will have 134.3 million. It's not a proud statistics. And it's an epidemic happening. Every diabetic can be affected with something. Diabetes is an incurable disease, and eye symptoms are too late, and that is why this program and prevention is better than cure. And we recommend primary checkup at the time of diagnosis. A lot of organizations mention that if you are 5-year diabetic, then you can do the eye checkup. But the problem in India is we don't check postprandial sugar or HbA1c every year. And then, for example, 3 years you're normal, and the 4th year you find you're mild diabetic. Then you can say you are diabetic that 1 year old and 2 years old. But in India, we have some boil or some surgery or some problem, you do a blood test and you found out sugar is 300 and 400. So the old lesson, prevention is better than cure, is very apt for the ophthalmologist. So primary prevention is the role of primary care physician, and that's where effective screening program for diabetic retinopathy. I'm happy to say I'm working with the Mahim Dharavi Medical Association, the Indian Medical Association. We have National Vice President Dr. Dr. Anil Pachnikar, who's practicing in Dharavi, and he's only the GP who did not close his clinic during COVID, and he was the one who helped the Bombay Municipal Corporation for the COVID to come down. And we are having our own clinic in Dharavi, and we are doing free clinic. And now with the Rotarian Kishore Rajshirke and Rotarian Kishore Masurkar, we are starting diabetic retinopathy free eye screening all the slums of Mumbai. So we want to determine who needs to be referred to an ophthalmologist for close follow-up and possible treatment. The reason we are doing this is diabetic patient that if they have no vision complaint does not mean they have eye problem. So that is a problem, and that's where we have introduced this screening through tele-ophthalmology. And our past president, when he made an Indian Medical Association and AIOS, he made the acronym for diabetes. Diabetes invariably affects both eyes. Test your eyes soon, and that's what we want to convey. There are a lot of NGOs and private clinics where go to the hospital and get it. So our request is go and get your eyes money, but I think our time you have to use drops, dilate your eyes and check. And every citizen deserves an eye checkup. And this is what I'm recommending to our Union Health Minister, Dr. Harshvardhan, I mentioned. So we have done some initiative where I'm happy all over India. We have various hospitals are doing like Arvind, Chitrakot, LV Prasad, the All India Institute of Medical and there's a community ophthalmology department. So we are using low-cost screening devices at primary eye care centers or in physician clinic. We also have the expensive size. We have the Indian made Trinetra, or we have that's a Forus, and then also the Remedio camera. And I think the most important is this is our clinic in the Dharavi, which is one of the largest slum in Asia. And this is our clinic where patients for diabetic are done free, and the other patients are charged only 30 rupees. In community outreach program we also do the blood test for the blood sugar diabetes. So we go door to door. We have screened about 200,000 slum houses, and we have touched about 8 million. And these are our social workers who go and test the blood. And also we have data of almost every house. And I think we have a better data than the Google of each house where it is located in Dharavi. And these are screening camps in all the lower middle class and poor area in Mumbai, thanks to Rotary Club of Mumbai Sand, that's my parent club. And we also have published this in the ophthalmic epidemiology, the AIOS Diabetic Retinopathy Urban Mumbai Slum Study. And there are several studies called SN Dreams, Shankaranayapalli Diabetic Retinopathy Evaluation and Management, and LV Prasad has done a study, AIMS has done a study, and I think and Arvind has got also a study. So this is our camp at Sholapur. That time we screened about 3,000 people, and we have a big team going everywhere. And they also created this again to create awareness on January 26th, 2019. Last year we screened 649 patients in 8 hours, and that means about 45 seconds a patient. We had 15 cameras, and this is a mobile phone attached to an infrared device. And we have trained anybody I have called a term called ABCD. Anybody can screen for diabetic retinopathy. So this is what we need, the NGOs help like Lions, Rotary, or anybody, or any donor, philanthropist. We want to create now the government of India has allowed during COVID, about 100 people can be assembled as per the government of India notification. So not more than that. So we create a pre-camp awareness, assembly of diabetics, capturing the retinal image, and that's what it will give, which will you can actually screen whether the patient has diabetic retinopathy or not, whether they have a potential for losing vision. And then we can either diagnose with AI or with the offline AI, or even the doctor can diagnose. And there is a national program for control of blindness by the government of India. They work all over India. There are several cameras. I don't have any financial attachment, any disclosure to make, where we can use mobile smartphone and take retina photographs, and that can be analyzed by the doctors. And you can see a smartphone and a regular phone, fundus camera, and see the comparison almost similar. And they also got approvals for taking photographs. And we are using the first in the world offline AI, which we have published in JAMA Ophthalmology. That was the most read article, where the blue part indicates that the computer will pick up and say the patient has retinopathy, and then they will analyze what type of retinopathy, referable diabetic retinopathy or non-referable. So out of 100, 5 or 10 may be referred to eye doctor. So our idea is to take this to every village in India, and then thereby we can for diabetic retinopathy. So this is the project of using offline AI in prediction of diabetic retinopathy. The sensitivity and specificity is about 100% and 88.4% respectively. We also have done diabetic retinopathy awareness and association with multiple comorbidities as a diamond study with our diabetologist Kiran Shah, and published it. So the summary is early detection and treatment after screening can the prevalence of diabetic retinopathy even in remote areas, and reduction in economic burden among poor and the urban slum people. The idea is if you diagnose early, you have to spend less. That means you don't have to do angiography, you don't have to do laser, don't have to do surgery. And we are also training boys like peons who are 10th pass or fail or school dropouts. We teach them one skill. Using this mobile phone, they can take photographs, and it will help to improve overall health of the population. So all of us know that the artificial intelligence is the way forward, and this is what is one of the companies have made, saying that in the next 3 decades we will see a technologically disruptive era, and we will both virtually and biologically merge together. And this is offline, and this is the video which you can see. Any school dropout can use a smartphone, and you can see take a photograph like this. And if the patient's eye people are small, and you can use 1% tropic drop, which again the healthcare workers can help you. And this is how the patient data can be collected. And there is a software which will say that the photograph image is correct, or it can be taken again. And then it shows you apply it in a offline artificial intelligence, and then it will say referable diabetic retinopathy or a non-referable diabetic retinopathy. And this is our idea of doing the screening, so that without doctors, without technical people, we can train semi-skilled people. And thanks to again Dr. Maipal and Dr. Namrata for signing an MOU with the health sector, the skill development. We have done a session in All India Ophthalmic Society conference in this year in Gurgaon in February 2020. There are several systems. This is a very expensive system, IDX system, which is approved in US, which is about 36 lakhs. Wisconsin has done. Forest has also come out with teleophthalmology software. Google DeepMind has come out, but still they are not able to come in the proper. So the Google AI, if you have seen the Sundar Pichai's video, it says it can predict heart problems by taking pictures of the eye. What it does is it measures the caliber of the blood vessel and then compares with the patients with a heart problem. And then accordingly, the AI will predict who can get the heart attack. So the key benefits of that's the future actually, it's not possible today. And the key benefits of artificial intelligence, diabetic retinopathy is a social and economic dimensions. Early detection enables specialists to focus on treatment so that you don't have to screen 100 patients and then select 5 patients to treat. Deep learning techniques, it has a continuous improvement outcome and relatively low cost and highly scalable process with quick response time. And we want to extend this stop blindness program to the Government of India, various state societies, Rotary clubs, Lions Club, Indian Medical Association, Association of Physicians of India, RSSDI. We have an Indian College of Physicians where Dr. Shashank is there, and also the International Diabetic Federation, Southeast Asia, where Dr. Shashank Joshi represents. And this was in Netrakum during a thanks to Forest. They sent the camera. Thanks to Professor Kamaljit, who did send his team to do that, and Manish Tandon took a screen. So this is what I say. Anybody can screen for diabetic retinopathy. And in this picture, you can see normal retina, early diabetic retinopathy changes, late changes, and then finally they lose vision. So why wait till last? And any retinopathy takes minimum 5 years to set in. So if we diagnose early, we'll be happy to treat early. So we have kind of consultants from Center for Sight, from Babu, Lalit Verma, Arvind, Dr. Kim Ramsamy, Dr. Rajiv Raman, from Shankar Netralaya, from Bombay, Dr. Kuresh Maskati, Dr. Subudhi, Dr. Partha Bishwas, Dr. Rani Padmaja, Dr. Rajalakshmi from Mohan Vishwanathan, and Dr. Radhika Krishnan from. So we have this AIOS National Committee for Diabetic Retinopathy Awareness and Task Force, and that's the meeting which was held, where we have even the Dr. Pramila Gupta from Government of India, and then we have Dr. Subudhi, Dr. Lalit Verma, all our AIOS office bearers, including Ornate India, which is a project from, you can see Dolores, project from the UK. And then I also went and asked help from Verily, which is the offshoot company of the Google. And Dr. Dimitri Azar is an ophthalmologist who was a dean in Chicago and now the CEO of Verily. And this is a team which is working with Sundar Pichai for also with Dr. Kim and Dr. Rajiv Raman for using the diabetic retinopathy. And they are still struggling to come out, but we are happy. We have published our results in the using offline AI, and that's the good for India. That's the AIOS to allow stop blindness nationwide via screening. So this is a video which I make. Are you a diabetic, hypertensive? Do you know you may go blind?
The world will forgive you, but will you forgive yourself? Diabetic blindness is preventable. If you're diabetic, you need a retina checkup. Diabetic blind.
So I wanted to say only this part. I'm just reminding that the world will forgive you in case, as an individual, you will go blind because of diabetes. But you are a burden to the family, to yourself, and to the country. And that's why we are making this movement. And then diabetic blindness is preventable. So only preventable when you start diagnosing early, not after you are diagnosed for 2 years or 5 years. And if you are a diabetic, simple thing you have to do is check your retina. So this is what I request through this public forum, to the Rotarians, to the diabetologists, to the physician, to the eye doctors, that if you are a diabetic, you need a retina checkup, and then tell them, put up banners, are you a diabetic and hypertensive? Do you know you may go blind? Because if you have a combination of diabetes and hypertension, and that's a deadly combination. I also thank Dr. Namrata, Dr. Maipal, and Dr. Rajesh, who are the President, Secretary, and Treasurer, for making this movie, where thanks to Allergan, and we have this movie, and thanks to the All India Ophthalmic Society for doing that.
You need a retina checkup to prevent vision loss.
So this is a public service initiative to prevent diabetic retinopathy. Thanks to Rotarian Ramesh Narayan, who was the past president of the Bombay Club, where he helped me to make this. And even now, through the International Advertising Association, I am trying to promote this again. Thank you, Ramesh. I don't know whether you're watching it, but and then we also have a thing in the mobile, which we can see. So this is my 3 generations. We are working to prevent blindness. And we are also, India is the first one to do the cataract surgery in the world by Shushusha, and then later in 17th century. And we have the first eye hospital in Asia, and not even in China, is our government eye hospital, Madras. That's where we 3 generations were trained. And I thank AIOS, I thank Indian Medical Association Prevention of Diabetic Blindness Committee, and also Organized Medicine Academic Guild, and specifically Rotary and Blue Cross Laboratory, who make diabetes drugs. And that's a 200-year-old eye hospital in Madras. So I wanted to quote Swami Vivekananda. He says, "They alone live who live for others, and rest are equivalent to death." I had a video where we carry the mobile camera in the motorbike, which we take all over slums and rural parts of. We are also doing a project in Palghar, which is the newest district in Maharashtra, which is about 100 kilometers from Mumbai city, Thana, rural Thana, and Nasik, all this place. So we can carry the place where the van cannot go. We can carry the camera in the van, in the motorbike. We need a room. We need a semi-skilled worker, a camera. So if any philanthropist can give camera and a salary for a semi-skilled worker, where we are working the healthcare sector skill, we'll be able to screen. Because we have 77 million diabetic. If you do daily 100, and every village, we have about 6,47,745 villages, and our Prime Minister is able to address the villages at least once and twice a year through the village panchayat, and we can train them also to screen for diabetic retinopathy. We'll have not only healthy India, we'll have an India with great vision, and I think we have to be a visionary. So I thank for a patient listening, and we are happy to take questions. And can I ask Ashish sir, as he's the managing director of Blue Cross Laboratories, who doesn't have anything to do with ophthalmology. Thanks to him, and thanks to chairman, who's my friend, Mr. Nishal Israni. He always supports. He has given me almost 1 crore in the last 10 years to do service in Dharavi. So people like them and the companies like that, they give, and I get the credit. So Mr. Ashish? Mr. Ashish?
Yes, sir.
Yeah. So you have any questions? Or, thanks for your support for this program today.
We're always there, sir. You know that, right? You ask, so we know that how passionate you are about helping people, right? So we are just being the facilitators. You are the one who is doing everything. So.
And Kishore and Maipal, and I want to say, Blue Cross Laboratories on their own are doing 1,400 camps on every 14th of the month for the last 2 years. Only thing is this year they are not able to do because of the COVID. But otherwise, they selected November 14 and they are doing, and we have done a tie-up with them as a president. Then they have, for logistic purpose, they said they wanted to work with the AIOS Foundation. I think Dr. Prabhu is there. Dr. Prabhu is the medical person from, and he's a public health person. Sir, I was telling Mr. Ashish that you are required for this. According to me, diabetic retinopathy is a public health problem.
Absolutely.
And it's under the NCD. It is number 1.
Yeah.
Excellent,
Right.
excellent work.
Dr. Prabhu is there? Yeah. Yes, sir. You have any points?
Sir, I completely agree to what you said, sir. This is a public health problem, and because I've been there for a decade in the working for public health programs across difficult tribal areas where even reaching out is a challenge. And as you rightly are taking this endeavor, this is really a great thing to do. And whatever help I can contribute, I will definitely be there for any cost, sir.
Sure, sure.
Yeah, thank you.
Thank you.
Thank you.
And Kishore, you have any questions or any questions you have got?
No, actually what you said is right, that one needs to do the retina checkup very regularly. But there is a misconception amongst people that if you ask anybody, have you done your eye check? He'll say, yes, I have done my eye testing, check my eyesight number. But there's a difference between checking eyesight number and the actually retina checking. So that awareness we have to create. And is the retinopathy is the cause, diabetes is the cause of this, or it can happen without that also?
No. That is why it's called diabetic retinopathy. It's a very valid point, Kishore. I think I wish you can talk on my behalf in the Rotary Club. Maybe along with the Rotary routine you have, wear the collar and do the national anthem. I think you can add one point. Checking the eye means check the eye from front to back. So my suggestion is, as you correctly pointed out, checking the eye does not mean checking retina.
Right.
So one is, in a clinic, we have to put drops and check. And here we have got non-mydriatic, what we call without drops we can check. But in India, we found 45% are successful using non-mydriatic camera. 55% we need camera to be used.
Yeah.
Oh, sorry, dilatation drops to be used. So the main thing is diabetes affects the small blood vessels of the body. That means because of the sugar in the blood more, it makes swelling proteins and lipids out of the blood, and that is the real thing which actually produces swelling and then makes the blood vessel choke, and then you get hemorrhages and exudates. And then later you still don't treat, some part of the retina does not get blood supply, and because of no blood supply, no oxygen supply, and because there's no oxygen supply, they grow a new blood vessel and they bleed, and that's how they lose vision. And then same thing happens in kidney, and that's why they get renal failure. Same thing happens in brain, they get stroke. And then same thing happens in feet, that means nerve supply, then you get the neuropathy. So diabetes is the root cause for when the person is diagnosed with diabetes, many times they will say, no, I don't control sugar, but I don't have any eye problem. And they are the bad advertisers, because diabetes sugar level and diabetic retinopathy also are unfortunately not proportional or connected. But if you don't control, that will punish the eye or kidney or anything. But if you, some people, even if you don't control, nothing happens. So the basic important fact and beneficial to the patient is uniform control, not sudden control or just numbers. Go to a diabetes doctor once a year, but routine control, you can go to a general doctor. You don't have to go to a diabetologist. But diabetologist is required because it is like seeing a whole forest and then you're seeing only one tree. So if you're going to a GP, it's like going to only a tree. But if you are going to a general diabetologist, he will see the full forest and say, hey, this place is having problem. You have to put water there, or the trees are drying, or some fire is happening. But otherwise, you will only take one tree. So I think it's a very excellent question you asked, which is very, very important for a lay person.
Right, right.
And then this will be, we are also doing live Facebook and live YouTube, which will be there all the time available. I wish all can screen and all can spread this message, and which will be there always. And anybody else wants to ask a question, who are there in the Zoom now? Or
yeah, anybody wants to question, they can send me either in chat, they can put their questions.
Yes.
Yes.
No doubt, sir. Everything clear.
Okay. Okay. I think the whole thing is, if you are a diabetic, check for blood pressure and also check the eye. And then not only once, you have to keep checking every year. If you are normal, every year. But in case you are having some changes, then the doctor will tell you whether to come monthly or a few days or few months, like that, depending on the eye problem. If you have diabetic macular edema, we give injections, which you have to test using a test called OCT, and then every month we check. But if you have hemorrhage, maybe you have to check frequently. And if you are operated, and again the doctor will tell when to come and how to come. So I think we had the best of endocrinologists available who gave a excellent overview. And then is Rajesh Sinha there? He left. Okay. So Dr. Prabhu, or anything else you want to add? You're muted, Dr. Prabhu.
Just nothing, sir, nothing. It was really a great presentation, and hearing you and Dr. Shashank, sir, it was really a pleasure.
Yes. So I think I'm personally thankful to Blue Cross Laboratory, even though I want to tell publicly that I don't give any business, neither help in any way. And I want to appreciate Chairman Mr. Israni and the entire team, not only Mr. Ashish. I think I have come to their office several times, Nilesh Sharkadi, and many people. I enjoy their lunch, their tea, and plus the way they work. I am really happy that you have done 1,400 camps every 14th. I wish the COVID goes and you restart, and we will be there. And today I found out we have 10 retina cameras thanks to the Tata Foundation and Bajaj and many others who have given us the cameras. So we can take cameras anywhere in Mumbai, and also we can talk to several companies and arrange the cameras wherever you want in this month. because I think all companies are cooperative. So whatever we do, the 77 million is a very, very big number. And we don't have that many eye doctors, nor general doctors, or even physicians. So if the patient does self-healthcare awareness, that means he reads about it or goes through a program like this. And then finally, I think we should, what do you call, screen everybody, and then only, and we, depending on whether they want to go to private or government, they can do. Because fortunately, even our municipal hospitals in Mumbai are well equipped for laser treatment and injections and surgeries too.
Yeah, Dr. Natarajan, one question I would like to pose here is received from one of the audience. Is that any advice for patient with kidney disease? So, what is the is there any correlation between that?
No, I agree. What is the kidney disease? Anything specific?
Not specifically mentioned. It's just a kidney disease. So,
see, kidney and eye, there are syndromes called Kimmel-Wilson syndrome, and then there are some things which can happen. But specifically kidney disease, we have to find out, because if it's diabetic, generally it will be diabetic nephropathy and diabetic retinopathy. And usually, if they're a diabetic and they have a kidney problem, definitely I have to be checked, because I also can have problem.
So that's what
only thing we
diabetic who has a kidney issues.
Then definitely I will be, as I told you, diabetes affects all the small blood vessels of the body. So eye, kidney, brain, feet, neuropathy, and heart has to be checked.
Okay.
And then another problem with diabetes is they have painless heart attack. So that is another problem they should know. And then the fluctuation of sugar also can affect retinopathy. And the vision problem is not necessarily will be there. That is where the early stages of diabetic retinopathy is missed, because patient says, I don't have complaint. So I tells them whether you have complaint or not, when you're perfectly normal, but you have diabetes for 1 year, 2 years, please check every year. And actually you are not losing, you are actually gaining, because eye is a window of the body. You can check the optic nerve, which is connected to the brain. You can check the blood vessel, so that we can indicate whether blood pressure changes are there. And also any other changes happening in the kidney, also we can see what is happening there.
One more question. Is there any impact of coronavirus on this diabetes or retinopathy, diabetic retinopathy?
So Rajesh has joined. Thank you, Rajesh. So
I'm sorry, actually there was some network problem, so I had to speak to the internet facility, and then some staff came and then it got corrected.
Thanks for joining. So, Sir Kishore, you are asking correct question. The comorbidities are a problem for this COVID. And COVID, I don't know whether you know, the COVID, the coronavirus was found by an eye doctor in last year, October. One eye doctor, Winling Lee from Wuhan, was treating a patient with the coronavirus, and he said there's a peculiar problem, and the fever looks like SARS fever, and the patient has glaucoma, and because of that, the doctor developed corona. He gave it to his father and mother. Father and mother survived, but the doctor died, and that was suppressed by China. He was also threatened for punishment, and so that is why we as eye doctors wear glasses, protective goggles, to prevent any coronavirus coming. In coronavirus, our hospital has published, and we have got several publications all over the world now. Coronavirus patients, after they discharge, they have been found, they can have occlusions of vein anywhere in the body, including the eye. So they develop retinal vein occlusion. Some patients have developed retinal artery occlusions. So if they develop that, they can have a severe vision problem. We ourselves published 2 patients, and one was a young girl, 17 years old.
So in such scenario, now one needs to make it compulsory for all this, who have recovered from the corona to get this eye checked up.
Correct. But the problem is when doctor says, they think we are making money. And you as a Rotarian president say, they will listen to you.
Okay.
See, for Dr. Rajesh, it's not a problem. He's a professor in All India Institute of Medical Sciences.
Right.
And they have, even today with COVID, even though the Delhi numbers are going up, they have patients. So you're right. So the problem is to make sure they check.
Yeah, correct.
Yes.
So I think I have two things to say. Thanks to Ashish sir and Panchanan sir, who is also our marketing director, for the detection camps that they have been conducting, and with a good number of patients getting screened. So this can also be, the retinal scanning can also be added as a skill to our people who are taking care of those camps. So that is one opportunity that I see as contribution from our side.
Already both came to the clinic, and we have done 2 camps in January, February, and because of COVID we have not continued.
Right. And second thing, what I see as an utilizing the public health structure, where every village has a dedicated worker in the form of ASHA. So do you feel that utilizing or giving a skill to them can further help us to reach out to?
Definitely. When I met Dr. Harshvardhan and the health secretary, I don't know, the new health secretary has come. The previous health secretary was Preeti Sudan.
Yeah.
And also the various health additional secretaries. They are not willing to spare ASHA workers for diabetic retinopathy screening.
Okay.
Somehow they are not convinced. So I am actually trying to push, because Tata Foundation is supporting Government of India for MCD, for diabetes, hypertension, not diabetes.
Diabetes and hypertension and cancer program, which is getting
the 3
implemented.
cancers. Teleradiology is supported by Tata Foundation. So I actually told Mr. Ratan Tata, why not you tell the government that this should be number 6 as the part of the MCD, even though it's not a separate disease.
Right.
Diabetic retinopathy screening has to be separate. That is why I've gone to Skill Development Corporation. So we want to make so for example, they had this like whether in UP or Bihar, we have made a program where the person doesn't know English, but they can know to operate a smartphone. They can be trained to take retina photograph, and whether it's Bhojpuri speaks or Hindi in UP or Bengali. So we can train them, 3 weeks training, and then they can get a Government of India certification along with All India Ophthalmic Society, and then they can go and screen. Fortunately, I presented this to Dr. Abdul Kalam when he was president. He was also asking me, will they harm the eye? I said, no, sir. We cannot harm the eye because we are taking everything from outside. Okay. So if we have data, one, we can use it for AI. The second is we can be sure of what is happening to the patient year after year. And it will also help to the research, as well as, again, helping back the patient and tracking the patient. So I think we are in time, and I thank everybody from my side. And as a formality, we want Dr. Rajesh Sinha is our senior office bearer in All India Ophthalmic Society. He's a treasurer, and he's a cornea expert and a refractive surgery expert and cataract. So he will give the vote of thanks on behalf of All India Ophthalmic Society. I wish the Rotary, the public programs will take up, and we from All India Ophthalmic Society, we have 23,000 eye doctors as life members. I think all of us are ready to support by anybody who wants help anywhere in India. Right, Rajesh?
Yes. We're looking for it to make a mass movement.
Yeah. Actually, this movement, as Dr. Natarajan was mentioning, we will definitely need help of Rotarians like you. And I mean, it's really a nice moment for me to thank you, because obviously Rotarians are doing a lot of activities, and diabetic retinopathy, prevention of blindness by diabetic retinopathy can be one thing in their, in their list of work. So, of course, I would like to thank you and all the Rotarians for doing all this work. And then, of course, Dr. Natarajan, who has been instrumental in doing diabetic retinopathy related projects for the last so many years. He has been actively involved in the All India Ophthalmic Society meetings and the activities of AIOS. He has been an office bearer for the last 20 years. So I thank him a lot for not only taking forward these activities, but also he also keeps educating others, and he increases awareness of other ophthalmologists also, that this is also one of our duties, that we have to increase awareness among general public also, that diabetic retinopathy is an entity which can happen because of these reasons. And so a big thanks to him. A big thanks to, of course, OMAG and IMA PDB group. Big thanks to Rotary Club and Rotarians like Mr. Kishore. And Dr. Shashank gave a very nice, a nice sort of input into what exactly, how diabetes affects the body. And of course, the AIOS president and secretary have been actively supporting this. So thanks to the president AIOS, Dr. Dev.
And Blue Cross Laboratories for the support of the webinar.
And the Blue Cross Laboratory, big thanks, because support, we cannot do anything. So big thanks to Blue Cross Laboratory for supporting this webinar. And of course our AIOS staff like Kripal, who has been, and Sunil, who takes care of this. So thanks to all of you. Thanks to everyone who participated in this public lecture, because your participation will help in reducing the magnitude of blindness because of diabetic retinopathy. So thank you very much. And we will definitely, under the guidance and under the leadership of Dr. Natarajan, we will keep having more of such activities so that it helps our own countrymen, and it helps in reducing blindness of the citizens of this country. So thank you very much. Thank you all who have participated in this webinar.
Thank you very much.
Thank you all. Thank you, Kishore.
Yeah, thank
you, Dr. Prabhu. Thank you, Ashish, and everybody who are there in the Zoom. Thanks to Sunil, and thank you all.
Thank you, sir. Thank you very much.
Thank you, sir. Thank you very much, sir.
Bye.
You can go, I think, stop the live streaming.
Very much, sir.